Namaskar, I'm Dr. Nutan Pakhare from AYJ Academy. I'm here to wish you all a very happy International Day of Yoga. Today we are having our student Deepika and Bhumika with me, who is going to show you yoga practices. So Bhumika is going to perform practices which can be followed by pregnant women during pregnancy, first, second, third trimester, and Deepika is going to perform practices which can be done by the couple and the woman who wants to conceive. So before conception practices, you can watch Deepika's posture, and after conception we are doing modification in the practices which can be done by Bhumika. So welcome to this AYJ Academy. Let's begin. So now first we will start with standing practices. So whenever we start practice of yoga, we have to specifically begin with Shanti part together. So let's begin. First we have to start our practices with Shanti part together. So I would like to request my trainer Deepika and Bhumika to condition yourself. Eyes closed. Pay attention on your breath. Listen the sound of your own breath. Relax face, neck, shoulder, back. All body parts should be completely relaxed. Now hands in Namaste Mudra, and we shall begin chanting Shanti part together. Let's start. Inhale. Om Sahana Vavatu Sahanau Bhunaktu Sahaviryan Karvavahe Tejasvina Vadhitamastu Ma Vidvishavahe. Om Shanti Shanti Shanti. Sit in silence for a few seconds. Let the breath come to the normal pattern. Feel your breath, feel your body. Relax completely. Then rub your palm, cup your eyes, cup your face. And then gently spread this energy all your body part by keeping hands in cross. And then spread it all over your body and bow down, offer the gratitude to Mother Earth, and then gently open your eyes, look at the ground first, and then take your neck to the front. Let's begin now Sukshma Vyayam. So for that I would like to ask my trainer to stand up. Okay, so let's begin with Sukshma Vyayam. Now Sukshma Vyayam is the practice which we suggest before you begin your asana, pranayama and meditative practice, because it helps for energizing and creating that movements to your joints and making it flexible to move ahead. So let's begin. Deepika and Bhumika, we will start with our finger movements first. Hands straight. Ensure you are standing correctly, equal distance between the feet. And now let's move your finger in and out. Yes. So you can also correlate these finger movements with your inhalation and exhalation so that you will become more aware to your small joints. You have to do this 5 rounds. After 5 rounds, we will do the fist movements first. Yes, very good. So slow, steady. The more you will do slow, you will feel your awareness at that part. 5 rounds inward and 5 rounds outward. You all can do along with us if you want to experience this. Now after this, we will move ahead to the next joint, that is elbow. So for that, take your hands straight and then exhale in, inhale out. Exhale in, inhale out. Exhale in, inhale out. Yes, 5 rounds, these elbow movement. Now we will do shoulder movements next. Inhale, join your shoulder front side and take it back. Yes, face relax, smile. You have to keep smile on your face so your facial muscle also gets some exercise. 5 rounds from front to back and 5 rounds from back to front. Slow, steadily. The more slow you will do, you will enjoy the practices. Now after this, after 5 rounds, you can take your hands down and yes. Now we will go ahead with only shoulder movements. Just lifting your shoulder up and rotating back. Very good. Now all these practices covered your finger to your shoulder. So this helps to energizing all the joints and influencing your synovial fluid which is present between the joints to regenerate and help you to become more flexible. Now after shoulder, now we will go ahead with neck movement, Brahma Mudra. For that you have to keep both the hands on your waist and exhale and take your neck down and keep breathing. Inhale, take your neck up. Your eyes should be open. Whenever you are doing Brahma Mudra or any standing practices, you should not close your eyes because there are chances you may feel giddy, or people who have a problem of cervical spondylosis or vertigo, they can avoid doing forward movement. Backward is fine. Now exhale, take your chin to the right side, right shoulder. Ensure your chin and the shoulder coming in one line and feel the stretching over the opposite side of the neck. Then exhale, come to the left side and feel the stretch on the right side. So like this you will experience more relaxation over this neck part, and you have to repeat 3 rounds. Continue. Meanwhile, I will explain the benefits of this Brahma Mudra. Brahma Mudra basically helps for your neck relaxation, muscle become flexible, and here we have carotid artery, vein, which actually supplies blood to your brain, and it improves the oxygen flow towards the brain, and so clarity occurs. Also we have neck muscle which release our stress when it get flexed and compressed and relax. Now after this we will move ahead to the next practice, that is our leg movement. So like we did the movements for our forearms and the shoulder, we have to also work upon the legs. And these practices are common for everybody, that is even before pregnancy and even after pregnancy. Only the difference, when you are pregnant, you have to take the support of your wall if you can't stand on one leg. So we will do Sukshma Vyayam for the legs. So both of you please focus on your both the legs given equal distance and then keep little bit 1 foot distance from each other. Now let's do Sukshma Vyayam. First take your one leg to the front and do up and down movements of your toes. Now Bhumika is doing the role where the first trimester pregnant woman, so she can take the support of wall while doing this movement to balance her whole body and doing it very slow, steadily. And Deepika is doing before conception. Now change the leg, so you can do 5 rounds of each. Now after 5 rounds, we can move further for the ankle movements. So again go back to right leg and do rotation of the ankle movement, right to left and left to right. Slow, steadily. Again your attention should be on that part. The more you are connecting with your whole body and the parts involved in the practice, it will help you for improving the circulation and the energy. Now in pregnancy there are a lot of pressure comes on the joints, so we are preparing for releasing those stress. Ankle and knee joints are very much important because as you move in the pregnancy in second and third trimester, there are a lot of pressure is going to come on these joints. So we are preparing right from the first trimester. And when you have to also connect with the breath and keep smile on the face. Now next we will go ahead directly for the hip movements. So hip movements, you have to rotate circular way, keeping the distance, and inhale and do the movements of hip. Yes, inhale and exhale. In pregnancy, little bit more slow. Yes, in first trimester, you cannot open the legs wider, but yes, you can definitely do the movements of your hip and you will feel nice pressure on the sole. So wherever you are moving, feel that compression or the pressure coming on the sole area. Inhale and exhale, correlate. You can do it little bit more, Bhumika. Yes, inhale and rotate. Yes, rotate circular. Yes, yes, that is also fine, no problem. Wonderful. So you have to do this 5 rounds. After this, now we will begin with the standing practices. Let's move ahead. Okay. So for that, again coming to the center, keeping the equal distance between both the legs, and first asana we are performing is Tadasana. In Tadasana, you have to take both the legs to the front, hands to the front, interlock fingers, then split and then take up and stand on toes. So if you are not able to stand on toes, you can also just keep your toes down and just lift your hand and focus your attention, and eyes remain open all the time during your standing practices, and experience the stretch, because ideally our hands remain down all the time, but in Tadasana you see the lateral extension happen. You can feel the energy here. Exhale and then reverse way, you have to come down, first toes down, then hands. Take your hands to the front and release the split. Take your hands down and relax. So in pregnancy, you can take a pause as per your capacity. Remember the thumb rule, 3 golden rules in asana. You can continue 2 more rounds. Meanwhile, I am explaining the benefits and the thumb rule for the practices. You have to pay attention. Number 1 rule is you have to pay attention on your breath. Second, you have to do slow, steadily. And third, as per capacity. So, Yatha Shakti, Shanay Shanay, and with Prana Shakti. And enjoy the practice. And reverse way, you have to take toes down, hands down, and come back. Wonderful. So we are doing 2 rounds here, but you can do 3 to 5 rounds as per your capacity. Now next practice is Ardha Chakrasana. Let's perform. For this, you have to again focus on your legs, giving equal distance and the pressure. Now keep both the palms on your back side and inhale and then back bend. Gentle way, you can back bend. Yes, so Deepika is doing more because she is not yet pregnant and Bhumika is pregnant, so she can modify her practice, giving her own capacity. She can bend, a gentle bending can be done, then exhale, come to the center. So you can do 2 rounds. Now here, what is the benefit of this practice? So when you back bend, you create a space over here. Even in pregnancy, it is important in 2nd and 3rd trimester. First trimester, when you start practicing, it will help your baby to grow better and also release back pressure, because the tailbone is also going to get compressed later on. So you are making your tailbone flexible here. And always correlate with breathing. Exhale, come to the center. Now the 3rd practice, we will do Ardha Kati Chakrasana. So for that, you have to stand crisscross and take one right hand on the right side. Yes, yes. And then take your palms towards ceiling, then take up and inhale and bend it on opposite side, lateral. So in pregnancy, you can keep your palms on your lower abdomen and take the opportunity to connect with the baby. And if you are not pregnant, planning, so you can also do the natural way, how we do generally this Kati Chakrasana. Exhale, come to the center. Slow, steadily, pay attention on each movement and reverse way, come back. Repeat same with other hand. Now this practice, so we've done Tadasana. In that we are raising our hand, but now Ardha Kati Chakrasana, here you will get more extension on the lateral side of the chest and the abdomen. And you will also feel stretching over the legs. Keep breathing and ensure the alignment part. Your shoulders should be relaxed and in align. Keep breathing and keep smile. Exhale, come to the center. Yes. And come back to the center. So this practice also you can do 2 rounds. Now after this we will do Garudasana. First trimester. So Garudasana, naturally without pregnancy you can do like Deepika is doing it like this, but modification you can see in Bhumika's posture, just like how Lord Krishna is standing like this, but the hand movement you can keep like this. So this will help you to balance and give little bit extension and the flexion over your lower limb and the coordination between upper and lower limb. Keep breathing, exhale, release the asana and come to the center. So in first trimester we are giving this because here we are not allowed to open the pelvic region. So we are just closing it in the Garudasana and we are strengthening by doing this. And before conception you can do like this, and this is literally helps to strengthen the calf muscle, your quadriceps and the hamstring and the back and hip region, and beautiful balance between your upper and lower. Wonderful, Deepika. Exhale, come to the center. Now we will move ahead to the next practice. This practice we can now go ahead when in second trimester we can give practice like Trikonasana variation. We will see in the Bhumika's posture and naturally how without pregnancy you can do Trikonasana. So for that you have to take your legs little bit apart, because the moment you enter into the second trimester you become more focused and more confident. First trimester we are focusing on the stability practices, and the second trimester we are focusing on the strength practices. And here you are allowed to make the space between the legs, widen your legs from each other and strengthen your back and the lower abdomen region. So let's go ahead, take your hands apart from each other and gently turn your body. So Deepika is performing Parivritta Trikonasana and this is called Trikonasana. Just gentle movement. When you are pregnant you cannot perform this Parivritta Trikonasana because it gives pressure on the abdomen. Here it is gentle twisting happen and it helps for the strengthening even your this part, triceps and biceps. So come back to the center. Wonderful. Yes. Do it on other side and we have to repeat this 3 rounds. So here before conception, people who are trying for conception, this Parivritta Trikonasana help to stimulate your reproductive glands and the organs become more active. Hormones, estrogen, progesterone also flows in a proper way. Come to the center and also abdomen and pelvic region become more flexible. Relax. Okay. Now after this we will move ahead to the next practice, Vrukshasana. In Vrukshasana, like we know that trees are very stable, and so we have to continue our stability practice as well as giving the space to the pelvic floor. So during pregnancy you can take the support of the wall and you can do Vrukshasana. When you are trying you can also do without support. Let's start. Take right leg, keep the sole to the left inner thigh and take your right hand and left hand both up and join hands. And your eyes remain open, focus on one point. pay attention on the breathing. Keep breathing. So stability or Vrikshasana also help us. Philosophically, if I want to explain this, being a mother, you are nurturer. So trees are very much example, natural example, which we see regularly. It nurtures, it gives fruits, flowers to all of us. So when you perform this, you can also develop your mental health and understanding. Being a mother, those thoughts are very important to cultivate. Now, exhale and take your hands down and come back. Vrikshasana, another benefit is it develops concentration practices and also leg muscle. Keep breathing and pay attention to the one point. So in asana specifically, you will see that there are three processes happening. First, you start asana, then you hold asana, and third, you release it. But when you hold, that time we can say the real asana or the effect of asana get benefited. So pay attention how long you can hold, and it can be as per your capacity. Exhale, come to the center. Slow, steady way you will develop the stamina, strength in you. We will do next practice, Virabhadrasana. In this, we say that we need to develop strength. So what is the best pose than this Virabhadrasana? Here we can see the variation. Just let's begin. Keep your first right leg to the front and left leg left side. Bend your right knee and then take your hands like we have done it in the Vrikshasana. Here the difference is you are getting nice stretch over the hamstring and the quadriceps muscle, back muscle, and keep breathing. And this also open up the pelvic region and the floor becomes strengthened. Keep breathing. Virabhadrasana, that means warrior pose. You also cultivate the qualities which you want your child to get into its own life, that is warriorness. Exhale and take your hands down. So here you have seen that Bhumika has kept her hands like this and Deepika has done Namaste. So whatever convenient to you, you can maintain that. Now next, so you can do this 2 to 3 rounds, because the more you do rounds, you will have that muscle development. The more muscle are strong, your mind is strong. So let's see how beautifully Bhumika and Deepika is performing it. And alignment, mainly you need to maintain the alignment of the body. Keep breathing and keep smiling. Exhale and come back. Yes. Now we will do Virabhadrasana sequence type 2. Let's perform. Variation. There are a lot of variations we have, and you can enjoy and make your class so inclusion and enjoying, so that the pregnant woman also feel to do it. And you are the energy in the yoga class. Whatever energy you will give, this will definitely develop muscle. Now in this posture, hands are remaining wide. So hands and legs both are wide, and this gives lot of strengthening over those muscles of limb and the stability in the center. Exhale, come to the center. Slow, steadily. Wonderful. Perfect. Do it both the side. Never miss when you start doing at one side, never miss to do it on other side, because that balances your Ida and Pingala Nadi, which are very helpful for bringing your energy to the center point. Keep breathing and bring the quality of the warriorness. If you want child like Shivaji Maharaj, warriorness, so you can remember Shivaji Maharaj in your mind while doing this, or whoever you wants to, you feel like they are warrior. So in female also we have Rani Lakshmi Bai. So wonderful. Come back to the center. Good. Now we will go ahead to the next practice, that is last standing practice, Utkatasana. So in pregnancy you can take the support of wall. Now Utkatasana also helps to create space as well as strength. So you can check, this can be continue even in the second and third trimester. Even preparing for yourself for the labor, you can start performing it right from the 7th month. 8th month you have to just control yourself doing all the hip widening asana and go back to the stability practices. 7th and 9th month this practice is recommended. Let's do it. Utkatasana, Bhumika and Deepika. So Deepika is going to do this asana for preparation for the pregnancy before you conceive, and Bhumika is doing the asana during pregnancy with the support, wall support, and you can also keep in mind that back should be straight and then you are going down and hands can be completely aligned. You can come this side. Yes, perfect. Keep breathing. Wonderful. And here Deepika is doing before conception. The whole weight is coming on this abdomen and the knee joint. Come back, inhale, exhale, come back. So you can perform these also 2 to 3 rounds. Now we need to go ahead in the sitting practices. Thank you so much, Deepika and Bhumika. Let's sit down, relax a bit. Yes, you can sit in Sukhasana or you can sit in Dandasana. Whatever convenient to you, you can choose your own practice. Aankhein band rahegi, close your eyes and pay attention on the breath. Yes, Bhumika can take the position whatever she feels. You can take your palms and rest. Dandasana में भी बैठ सकते हो आप लोग. Keep your palms on the ground, Bhumika, and rest your neck on one side. Thoda back bend. You can also go back side little bit and drop your neck on the right or left shoulder wherever you felt. And you can spread your legs if you want. Yes, and relax a bit. This is called Dandasana, sitting relaxative pose. Now in pregnancy also you can take the support of wall and sit like that, or any pillow, anything, whatever you feel. Now after this we will move ahead with Parvatasana, sitting Parvatasana. So for that you have to again come back to your Sukhasana or Padmasana pose. So in pregnancy you can do Sukhasana if you can't do Padmasana, because second and third trimester due to tummy is already grown up, your baby is grown up, so you may not be able to sit in Sukhasana or Padmasana. So, and you can definitely take a break in between. It's not compulsory during pregnancy you have to do all the things at a time. Pause is required to regain your energy. Basically yoga gives you energy, so if you can do it continuity, it's good. Now let's move ahead with mountain pose. Now again mountain is resembling like, your body should resemble like a mountain, and it is again creating that stability in you, so, and the strength. Now join hands in Namaste, and this Namaste mudra can be near to the navel region. You can also, Bhumika, keep your hands near the belly and connect with the baby, and take your baby also in this practice. And now connect your hands in Namaste. Inhale, and you can take your Namaste mudra slowly towards upward. Eyes remain closed, Deepika. To gain the most benefit from this asana, you have to always close your eyes and follow Pratyahara, that withdrawal of your sense organ from going towards external object. When you close eyes, you are more tuned with inside state of mind and the consciousness. Keep breathing and feel the stretch. Now here also our hands goes up, so the lateral side of the body get more stimulation and muscle also feel relaxed. Exhale, come to the center and experience when you take your hands down how your muscles and your consciousness state, your body and the mind are related. You feel more relaxed when you take your hands down. Correlate with exhalation, inhalation. And you have to repeat again, do it. Take your hands near the navel region, Bhumika, so that you can connect with the baby in the womb. Inhale, again begin. Take your hands towards the heart, then throat, then in the center part of the eyebrow, and then over the crown region and then up. So elbow remain extended and feel that. So keep breathing and feel that spine and the lower back also feel more relaxed. Exhale, come to the center, come back, slow steadily, and keep your hand near the womb and feel yourself more powerful and strong like a mountain. So what we see as a mountain, broad base and the taper end. So in this posture we have been creating that resemblance like a mountain. Now we will move ahead with Dandasana and then Vajrasana. So extend both the legs forward and relax for some time. You can also take some time to just move again your toes, ankle, and even pressing your knees down. So this will help your joints to just become flexible and ready for the practices. Okay, now let's go ahead with the Vajrasana. This is the only practice which you can do before and after meal. Vajrasana helps for the indigestion, acidity, or whatever digestive disorders are there for that. And in pregnancy, acidity, nausea, vomiting are very common due to indigestion. So you can take opportunity to sit like this. Now I would like to ask Deepika to turn backward and how you need to sit in Vajrasana, like your toes touching toes and make the cup of the heels, so that, and rest your hip on that cup and back will remain straight. So this way in pregnancy what you need to do, so the first trimester there you can do like this only without any modification, but in second trimester I would like Bhumika to keep the distance between the leg because the tummy will increase and she may not be able to sit in this pose, and that may create pressure on the lower abdomen. So you can see how beautifully she is able to sit in Vajrasana. Now calf muscle are very important in pregnancy. Blood flow, maintaining blood flow and the blood volume, we need to give relaxation to the calf muscle. So in this pose many benefits you will experience. Now moving ahead with this pose, now we will go ahead with the Ustrasana. So you can just stand on your knees. Yes, Deepika, you can be like this or the lateral way so that the people can see what happens, how you go backward. Now in pregnancy, now both the time just raise both the hands up, one hand, now right hand remain like this and left hand turn and touch your heels backward. Now before pregnancy, when you are doing this asana, it definitely helps for increasing your oxygen consumption because here you open your chest and even abdomen gets stretched. During pregnancy, you can take your own way. If you can't bend backward, you can just take your hands up, one hand up and the second hand, Bhumika, you can keep on the lower abdomen. एक हाथ ऊपर ही रखो, हाँ, and दूसरा हाथ, don't touch heels, just touch your baby and just remain like this, keep breathing. So this is the variation which you can do if you can't touch your heels. And both the heels will remain like this, toes down, not like that, yes. And keep breathing and feel. Eyes remain open. Exhale, come to the center. And sit in Vajrasana. Take a break and you can also repeat same on other side. If you are watching us, so you can also perform along with us. But I would like to request pregnant women should not do just watching our video or any YouTube video. You have to have your pregnancy yoga teacher to monitor and help you to balance. Keep breathing and exhale, come to the center. And sit, relax. So you can do this 2 or 3 rounds. In fact, final round you can also take both the hands and touch your heels. So I would like to request Deepika to do that because in pregnancy if you prepare your whole body and also able to touch heels you can, but under the guidance. Without guidance never try it. because we don't want to take any risk. Keep breathing, and this literally helps even in pregnancy for improving oxygenation, and your chest, shoulder muscle also get more benefit and strength. Exhale, come to the center. So during pregnancy, you have to remember that the knee will remain widened in second and third trimester. Now, next, we will move ahead with Marjari Asana. So, in the same pose, you can just bend both the limbs, like knee and your palms will be resting on the ground, and keep the alignment. Knee and your palms should be in alignment state. Bhumika can just make little bit wider. Now this is called Marjari Asana or even cat cow pose. In some places we also call it like Chiri Kriya. Let's do it. Inhale, exhale in and inhale out. So when you exhale, you have to take neck down and your middle part of the back will raise up. And then inhale, again this middle part will go down and head will be up and eyes remain open. Or if you want to close eyes, you can, because you are completely safe on the four limbs. Continue. Inhale and exhale, and this is the best pose for the pregnancy, because in pregnancy there is a lot of pressure coming on the abdomen and the whole spine and the back. So this literally gives more space for the baby, as well as it relaxes muscle. This also relax your thighs, backside of the thighs. Exhale. It is also preparing your shoulder, because after delivery you have to carry your baby in your arms. So we are strengthening your biceps, triceps and the forearms. Exhale, come to the center. Your wrist joint also needs to be stronger to do this asana. Now come back and sit in Vajrasana. And whenever you are resting, you can close eyes, take time. I would like to ask both of you to keep hands near the womb, near reproductive system. If you are working for fertility before conception, or if you are pregnant after conception for your baby connection, you can take time to talk to your baby, because Garbha Samvad is very much important part for connecting prenatal yoga or pregnancy yoga and enjoying the pregnancy journey. Now exhale, come back. We will do now resting pose, that is Shashankasana. In Shashankasana, you will need to take the support of some props. When you bend forward, your head will touch to the ground, and that way blood flow happens towards the brain, and our brain requires 20% oxygen, and in this pose definitely you will be able to improve that blood flow and the oxygen towards brain, because your brain is coordinating each and every organ in your body, and in pregnancy obviously it is taking care of baby as well. So let's move ahead. So take both the hands up. So before pregnancy you can perform like this. Deepika is doing it, compressing, and it is also compressing the abdomen part. Now in pregnancy we can't do this. You have to take 2 to 3 pillows to do this, perform this asana. So I would like to ask Bhumika to visualize that and bend it accordingly. Or without even, if you don't have props, you can also just take your hands parallel like this, and lift your hip up. Lift your hip up and just take your head down. Keep breathing. Or you can also do this asana, which we call it as a Adho Mukha Svanasana. Yes. Adho Mukha Svanasana. Yeah, like this. So here you are not creating pressure on the abdomen, as well as you are giving that blood flow. Head is low, so blood flow happening towards the head. Keep breathing and also strengthening your calf muscle. Keep the distance between the leg, Bhumika. Yes. Now exhale again, slow, steadily. First touch your knee down and then come back. And Deepika, you can just come up. Exhale. Yes. Keep your face smiling. Deepika is maintaining that. Bhumika, I can understand in pregnancy it is quite possible, mood swings and the connection. So ensure that you are also keeping in mind that if you are happy, then only your baby will be happy. Now the next, Baddha Konasana. So for that, extend your leg and touch both the sole with each other. Now here you can also sit with taking support of the wall, Bhumika. So Baddha Konasana is helpful for creating the space. So it is recommended in second and third trimester, and before pregnancy it improves the reproductive health. So you can keep all those benefits in mind and focus your attention on the lower abdomen, and back remain straight and close your eyes to get more benefit. Now in this you will realize that blood flow is completely directed towards the lower abdomen, and that's how it improves reproductive health as well as even during pregnancy for baby. Since baby is residing in the uterus, there are two special organ develops in the 7 to 8 weeks of pregnancy, that is placenta and umbilical cord, which transport all this oxygen and nutrient towards the baby from mother to baby, and all that metabolic products sent back from baby to mother through this channel. So uteroplacental strengthening, circulation gets strengthened. Exhale and release. Many women are going through these obstacles during pregnancy, like these organs, placenta and umbilical cord, low-lying placenta or umbilical cord issue. So when you perform this practice, you prevent those obstacles coming in front of you. Keep breathing, take time to do Dandasana. Now after this, we will move ahead with supine posture. So in pregnancy, we cannot do prone posture, that is on abdomen, because we have to keep in mind we don't want to create any pressure on abdomen. So only you are allowed to do the supine posture. So here we will perform that. Lie down. So you can take your legs on that side, head this side. Always remember, whenever you are performing, where your teacher is sitting, you have to keep your head towards the teacher and legs opposite to it. Keep breathing. And in Shavasana, this is the Shavasana where you have to spread the legs away from each other maximum as much as you can, and you can keep your hands on the womb. If you in pregnancy specifically, I would prefer that. Bhumika, you can keep both the palms near the lower abdomen and feel the connection. So take time out to relax and connect with your baby. You can also talk to your baby, feel the movements, how many times baby is giving you kicks, and also connect with your womb. Before pregnancy, you can also strengthen your reproductive health, and paying attention towards your Swadhisthana chakra is definitely going to improve your reproductive energy. Now exhale, come back, take legs together. So I would like to add one more asana here, breech pose, that is we call it as a Setu Bandhasana. So this is literally helps in pregnancy first, second trimester. You can do it, bend your leg. In pregnancy, just keep in mind, keep the legs widen from each other. Don't take heels towards the hip, little bit widen. And now inhale and lift your hips upward and take the support of the palms over the hip and lift up. So this way you are increasing the space. So this is space building asana as well as stability practices. People who are going from obstacle like low lying placenta in first trimester also, you can perform this practice. This will literally help for strengthening your pregnancy and stabilizing it. Mother and baby both needs this strength, and it also develops the quadriceps and the hamstring muscle to get more strengthened, and calf muscle also get more energy. Now exhale, come to the center. So you have to repeat 2 to 3 rounds of Setu Bandhasana and then relax it. Turn on one side Now we will go ahead with resting pose, Balakasana. So before pregnancy, you can you can definitely bend your knees and take towards the abdomen, but during pregnancy you cannot bend too much. So you can keep your legs little bit downward, or you can use pregnancy pillow because that will give more comfort to your abdomen, and take your head like this. Wonderful. Yes. After that, you have to do this on other side as well. Turn on other side. Keep breathing. Deep inhale, deep exhale. Always remember, whenever you are resting, you have to connect with yourself, and breathe is the only medium through which we can connect our body and mind together. Now, take the support of your palm, take your palms to the ground, and then take the sitting posture. Keep your eyes closed as much as possible. Unless and until your instructor didn't ask you to open eyes, remain connected with the self. Now after this, we will move ahead with pranayam practice. First, we will practice Lom Vilom Pranayam. So for that, we will prepare our breathing awareness technique, that is Dirgha Shwasan or deep breathing. And you can take one palm on the chest and one palm on the tummy and feel your breath. Keep breathing. Deep inhale and deep exhale. Deep inhale and deep exhale. Back remain straight, face relaxed, shoulder relaxed, all body parts should be relaxed. And exhale, take your both the hands back to the Jnana Mudra. And Bhumika can keep both the palms near the belly. And pay attention on your breathing. When you inhale, your chest comes up, followed by abdomen. When you exhale, your abdomen goes in, followed by your chest. Your face relax, neck relax, shoulder relax, all body parts are completely relaxed. Now we will move ahead with pranayam practice. So pranayam is the practice where you are taking pause in between inhalation and exhalation. So it is defined in the Patanjali Yoga Sutra, Tasmina Sati Shwasa Prashwasa Yoragati Vicheda Pranayam. So we are performing here practically. People who are practitioner of yoga and pranayam, they can hold their breath, that is kumbhaka can be practiced, but people who are not practitioner, they can first master themselves in inhalation and exhalation and breathing awareness. Now since Bhumika and Deepika are yoga teacher and practitioner, so I will take kumbhaka as well. So there should be ratio 1:2 first, like if you are breathing 3 second inhalation, then 6 seconds should be your exhalation. So that ratio is called 1:2. And when we include kumbhaka in this, we have to start with 1:1:2. That is 3 second inhalation, 3 second hold and 6 second exhalation. So like that you have to improve regularly this ratio of holding. That is what pranayam is. Now we will see the demonstration. This is Nadi Shodhan Pranayam or Lom Vilom Pranayam. So for that I will ask both of them. You have to make the mudra where your Pranav Mudra, this is called Pranav Mudra. Here you are touching this index finger and the middle finger at this point, and the thumb remain like this and 2 fingers are like this. Once you are ready with this mudra, now take your thumb and touch and close your right nostril, and then inhale from the left nostril, and then close your left nostril and exhale from the right nostril. Now inhale again from the right nostril and exhale from the left nostril. So this is one round of inhalation and exhalation. So 1:2 ratio. So when we inhale, we have to count 1, 2, 3, and when we exhale, you can count 1, 2, 3, 4, 5, 6. Again inhale, 1, 2, 3. And exhale, 1, 2, 3, 4, 5 and 6. So like that you can repeat 5 rounds initially and increase even the counting. So this is Lom Vilom Pranayam. Now how it helps in pregnancy. So when we have Ida and Pingala Nadi, which are the energy channels, and the Sushumna Nadi is the center channel for us. So when we do this practice, we centralize our energy channels and all the energy come to the center and we become more aware, and our blood flow towards the brain and the vital organ improves. Blood circulation becomes more even and calm and composed. Happy hormones also release, that is dose hormone, that is dopamine, oxytocin, serotonin and endorphins, and all those hormones are going to help in pregnancy as well as in the reproductive health development and reduce stress, specifically reducing stress. Exhale, come to the center. After 5 rounds, you can take your hands down and sit in silence for a few seconds. Give some time to absorb the effect of this pranayam. Now we will do second pranayam, that is Bhramari pranayam. In this you have to inhale with both the nostril and exhale with humming sound. Inhale. So you have to repeat this 2 to 3 rounds. This humming sound literally helps to vibrate positively in the mind, and the whole body points also get energized. Continue 3 rounds of this. Again, this particular practice you can also use Shambhavi Mudra. In this you can just take time to just close your all the sense organ, that is your eyes. So Deepika is going to perform Shambhavi Mudra. With Shambhavi Mudra here, and the thumb remain inside the ear, so you are not listening external voice. Now let's do. Inhale. The more humming sound is there, you are exhaling more carbon dioxide or the toxins from your body and mind, and it gives you more relaxation and definitely calm and composed mind, which is required during pregnancy. All your stress will dissolve when you practice this. Exhale, come to the center, take your hands down, Deepika, and just experience the center point. Now if you do this pranayam practice, it will also develop your concentration. You can pay attention on the center point of the eyebrow. Concentrating on the center point of the eyebrow, Bhumika can also focus on the Swadhisthana chakra, that is the belly part, and the baby. She can recollect or visualize her baby growing in the womb. Deepika can visualize her whole body parts from top to bottom and the reproductive system, transmitting all this energy from the Agya chakra to the Swadhisthana chakra, and this will improve HPO axis, that is hypothalamus, pituitary gland and ovary or the reproductive organs. And this is what required to strengthen for the pregnancy and the fertility development. Now after this, meditation happens by default. Meditation cannot be done, as I said in my lecture series as well. It is by default happens your mastery in the concentration practice. Now after this, we will go ahead and conclude this whole session with chanting Om. So join hands in Namaste. Now Om chanting, we can understand there are 3 syllables A, U, M. So A can be felt in the abdomen, U can be felt in the heart, and M can be felt in your throat and your head and the Swadhisthana crown chakra. While chanting, if you connect this way, it is said that Om is the first sound which has been heard on this planet Earth. So the more you chant Om, it will energize you and connect you with the nature. Let's begin. Inhale. 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 Om Shanti, Shanti, Shanti. We can also chant the Shanti mantra in the end. Om Purnamadam Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnamevavashishyate. Om Shanti Shanti Shanti. Gently rub your palm, cup your eyes, cup your face, and spread this energy all your body parts. Bow down, offer the gratitude to Mother Earth, and gently allow your eyelashes, eyelid to open up. Look at the ground first, then towards the womb, and then to the front. Namaste. If you like our session, please share this video with the maximum people. And if you have any question, please ask in the comments and we are happy to help you out. So enjoy this practice, and once again wish you all very happy International Day of Yoga. I would like to offer my gratitude to Bhumika and Deepika being part of this celebration and this video. And even we would like to offer our gratitude to Indian Yoga Association. Thank you. I'm signing off from AYJ Academy, Mumbai, India. Thank you.